If you've researched antiviral herbs that help to combat the common cold or flu, you've probably come across Echinacea, a powerful plant that's currently booming in the natural health market. Once known as an alternative way to prevent the common cold, now Echinacea is quickly becoming known for multiple uses and benefits, from combating cancer to alleviating pain. Echinacea is a native North American coneflower, and it was discovered and used as a traditional herbal remedy for more than 400 years by the Great Plains Indian tribe. Technically classified as a herb, several species of the Echinacea plant are used to make medicines from its flowers, leaves, and its roots. Prior to 1950 and the introduction of antibiotics, Echinacea held an esteemed medicinal status. As the healthcare industry shifted, antibiotics became the rage, and the now famed herb lost much of its esteem. It's become a popular plant to grow, also called Echinacea purpurea, commonly known as the pale purple coneflower, a flower that resembles daisies with mounded heads and rose, pink or purple petals. It grows on strong stems far above the foliage. Most people don't realize that the chemicals contained in the root differ significantly from those in the upper part of the plant. If we analyze the root of the purple coneflower, we can see they have high concentrations of volatile oils, while the parts that grow above the soil tend to contain more polysaccharides that are known to trigger immune function. Echinacea extract is essentially a tincture from the upper part of the plant. Many of Echinacea's chemical constituents are in fact powerful immunity stimulators, and they can provide a significant therapeutic value. A few that you're probably familiar with are essential oils, flavonoids, inulin, polysaccharides, and vitamin C. On top of reports of the plant's highly nutritious extracts, we've learned that the portion of the plant that grows above ground is the most effective. Interestingly, in Germany, dietary herbs are regulated by the government, and the above ground part of the Echinacea purpurea species are actually approved as natural remedies for urinary tract infections, upper respiratory tract infections, colds, and slow healing wounds. Fascinating research about Echinacea's benefits regarding brain cancer have been published by the National Institute of Health. Researchers state the medicinal value of the phytochemicals contained in Echinacea is clearly evident, and it indicates that these agents, as well as the phytochemicals not yet discovered in other herbs, may be valuable tools to combat tumours. The use of Echinacea as another alternative cancer treatment is now being recommended, literally alongside or indeed in the place of conventional therapy, according to the researchers. In the journal Lancet Infectious Diseases, the University of Connecticut performed a meta-analysis study that evaluated the effects of Echinacea using 14 studies. It was determined that Echinacea can reduce the chances of catching a common cold by 58%, and Echinacea reduces the duration of a common cold by almost 1.5 days. Craig Coleman, Assistant Professor of Pharmacy Practice and lead author of the study, added, "The take-home message from our study is that Echinacea does indeed have powerful cold prevention and cold treatment benefits. This is exactly why Echinacea products are one of several effective cold remedies." Dr. Coleman found that the significance of the finding becomes clear when you consider that Americans suffer from 1 billion colds annually, and they spend around 1.5 billion annually for doctor's visits and another 2 billion annually on non-prescription cough and cold treatments. The United States Department of Agriculture Natural Resource Conservation Services report that the immune system seems to be strongly influenced by the level of the Echinacea dose. It appears that 10 milligrams of Echinacea per 1 kg of body weight, taken daily for over a 10-day period, is effective as an immune stimulant. In addition, the medicinal journal published materials suggesting that Echinacea stops viral colds. However, the most significant results of Echinacea's benefits were the effects when used on recurring infections. To date, research shows that the plant probably reduces cold symptoms, but it seems that the effects of the Echinacea are more powerful once cold symptoms start. Another study published in Virus Research, evaluated the effects of Echinacea against viral and secondary bacterial infections that often follow. Plant extracts were able to fight viral respiratory infections, including the flu, while also reducing inflammation and reducing the risk of developing bacterial complications. Therefore, you can see why Echinacea products are used for viral illnesses such as the common cold and the flu. Particularly, extracts are a favourite recommendation for integrative physicians, homeopaths, naturopaths, and for their patients. Echinacea's history began when the Echinacea purpurea was used by the Great Plain Indians as a painkiller. It's an especially effective pain reliever for the following types of pain: pain in the bowels, pain associated with headaches, pain associated with herpes, pain associated with gonorrhea, pain associated with the measles, snake bites, sore throats, stomachache, tonsillitis, and toothache. Like many herbs, Echinacea is particularly healing for the stomach and the entire gastrointestinal tract. According to medical herbalism, for example, Echinacea has shown to work as a mild laxative that provides constipation relief and works as a calming agent. Drinking the herbal tea is especially effective to help with this. For more chronic conditions, a cup of tea every day can help to loosen the bowels, whereas 2 to 3 cups per day can help with sudden bouts. Arguably, the number one killer worldwide, inflammation, is at the root cause of most diseases. Various factors, including stress, toxins in our food, and poor sleep, all contribute. Thankfully, as explained by the University of British Columbia, regular Echinacea consumption can effectively reverse and alleviate various types of inflammation. Products containing Echinacea may help with uveitis or eye inflammation. It's a good idea for people who struggle with chronic inflammatory conditions like rheumatoid arthritis to regularly consume the herbal tea in order to reduce the system-wide inflammation in the body. Echinacea benefits the skin as well, including improving skin hydration and reducing wrinkles. Research shows that using skin products containing the plant's extracts can help to boost skin health. Plus, it showed no side effects like skin irritation. Echinacea angustifolia is the recommended species to help with specific ailments related to ADD and ADHD. Both adults and children suffering from ADD and ADHD have a higher than normal chance of experiencing emotional disturbances, especially anxiety, depression, and social phobias. Again, the dose is the key. It's recommended that people only take 20 milligrams at a time and no more. In fact, taking more than 20 milligrams per dose can actually cancel out Echinacea's benefits that relieve anxiety. Because of its immune boosting and anti-inflammatory effects, research indicates Echinacea can work to improve many upper respiratory infections, including acute sinusitis, all flus, asthma, common cold, croup, diphtheria, inflammation, strep throat, tuberculosis, and whooping cough. In fact, in a clinical study of asthma sufferers, Echinacea acted similarly to classic synthetic drugs in treating asthma. Researchers wrote that recent studies have shown that the secretion of asthma-related cytokines in the bronchial epithelial cells can be reversed by Echinacea preparations. In particular, Echinacea showed significant bronchodilatory and anti-inflammatory effects. Study authors concluded this provides a scientific basis for the application of the herb in traditional medicine as a supplementary treatment for allergic disorders of the airways like asthma. For more severe issues, supplement products are the way to go, as drinking the tea, for instance, is just not concentrated enough. Echinacea is also a fantastic remedy for a whole slew of infections. One study found that taking Echinacea and applying a medicated cream to the skin can lower the rate of recurring vaginal infections by up to 16%, compared to simply taking the medicine alone. It's also known to help with bloodstream infections, genital herpes, gum disease, malaria, syphilis, typhoid, urinary tract infections, and vaginal yeast infections. A review of 82 studies published in 2018 in Evidence-Based Complementary and Alternative Medicine concluded that Echinacea use, 2,400 milligrams of extract per day, for 4 months may help to keep you from catching a cold, or at least reducing the severity and the duration of the symptoms from the day that you catch it. A meta-analysis of studies published in 2015 in the Journal of the American Medical Association found echinacea use, if started when the first symptoms appear, can help to modestly reduce the duration and the severity of the common cold. A Cell study published in 2009 showed that various types of flu viruses, including potentially lethal bird flu and swine flu, were unable to infect cultured human cells that had been exposed to Echinacea extract. While lab study findings don't always prove true in living humans, these results, combined with the results of human studies, show the benefit that Echinacea has in humans, suggesting the Echinacea can be worth trying if you've been exposed to someone with flu or if it's going around in your area. A study out of Europe published in 2015 indicates that Echinacea was as effective as the prescription medication oseltamivir for lessening the severity and the duration of flu symptoms, as well as for preventing adverse effects when started at the first sign of infections. It's important to take Echinacea at the first sign of flu symptoms to be most effective. In addition, other Echinacea use supported by research includes combating cancer, boosting immunity, alleviating pain, treating constipation, fighting inflammation, improving the skin, supporting mental health, and relieving upper respiratory issues. It's important to know that there can be side effects when taking too much Echinacea. In some cases, high doses of the plant's extracts can sometimes cause nausea and dizziness, particularly in those who have allergies. Therefore, it's not considered safe to use Echinacea for the treatment of seasonal allergies. It's also been reported that injected Echinacea can cause more severe reactions like diarrhea, disorientation, dizziness, dry mouth, fever, headaches, insomnia, joint and muscle aches, nausea, numbness of the tongue, sore throat, stomach pain, an unpleasant taste, and vomiting. Some sources claim that Echinacea seems to be most effective when taken as soon as symptoms appear, and taken many times a day for 7 to 10 days. It's also believed that liquid forms of Echinacea may prove more effective than capsules. There's many traditional Echinacea benefits and uses, but the strongest scientific evidence available currently supports Echinacea use as Echinacea extract or Echinacea tea as a way to help to slow the development and reduce the intensity and the duration of upper respiratory viral infections like the common cold and influenza. Other Echinacea use supported by research includes helping to combat cancer, boost immunity, alleviate pain, treat constipation, fight inflammation, improve skin, support mental health, relieve upper respiratory issues, and more.